Hi guys, my name is James Rana. In this presentation, we will talk about vibrio cholerae, or known as cholera. Here, we will talk about the basic introduction of what is cholera, how it is transmitted, what are some risk factors, some of the clinical findings that I have found about this bacteria, what are the complications if the person gets infected, and lastly, the diagnostic methods of how to prevent it and what are some treatments that can be done if the patient is infected. Let's get started. Cholera is a gastrointestinal illness in which affects your stomach and your normal flora. It is caused by an infection with gram-negative bacteria called vibrio cholerae. It is a facultative anaerobe curved slash comma-shaped bacteria and with the motility of polar flagellum. It is called traveler's diarrhea, in which when a traveler visits a poorly unhygienic place and has eaten or drunk contaminated foods. Like I said, it, it can be found in tropical places, but it is endemic to many countries such as Africa and Asia, where they are poorly practiced being sanitized and hygienic. All right. Based on worldwide estimates from the World Health Organization from the 2020 survey, approximately about 1.3 million to 4 million cases of cholera each year, and approximately 21,000 to 143,000 death, deaths caused by cholera each year. How it is transmitted, and what are some of the risk factors. First is transmission. There are two ways how cholera is transmitted. The first one is ingestion of contaminated food and water. Vibrio cholerae lives and survives in salty body of water and attach themselves to a chitinous species. For example, that are shrimps, crabs, crawfish, and lobsters, and more. Basically, a species that has shells. Second way of transmission is human to human contact. Possible possible way of human to human transmission is fecal oral route. This is where when an infected person swim in a body of water and a second person accidentally drink that infected body water. Excreted in stool from the infected patient in which the person who excreting the sample got infected. Some of the risk factors. The first one is decreased sanitation in where people are being unhygienic and poorly practiced sanitation. Second risk factor is ingestion of contaminated foods. This is where foods are not properly cooked or water is not boiled properly for safe drinking. This is this is where bacteria will grow and become a factor. Third risk is the decrease of gastric acidity. Your gastric will start malfunctioning and having problem because of a cholera. What are some clinical findings that I have found? Incubation period is about 2 to 3 days on average, but can be anywhere from 2 to 5 days. It is also variable depending on the host factor. Each person who got infected with cholera may affect differently, and host to host will have different reaction. Contagious period. It is not contagious, but can affect if sanitation is not practiced carefully. What are the signs and symptoms if the person is infected? First sign or symptoms if the person is infected is diarrhea. The second one is vomiting. Third is thirst or dehydration. Fourth is restlessness if the person have feeling uneasy, and lastly is irritability if the person is feeling a little bit more than irritated because of he or she feeling about the situation. What are the complications if the person is infected? First complication is severe dehydration. If the person is losing a lot of fluids, his or her body. Second is renal failure, in which is renal tubular acidosis, in which the person cannot stop having bowel movements. Third complication is can lead to a kidney failure because of losing too much water can affect the kidneys. And lastly, and serious complication, if it left untreated, it can lead to a shock, coma, or even death. Here are some other complications. Hyponatremia, in which person is more fatigued than usual because of losing too much fluids in their system. Hypocalcemia, in which losing calcium. Hypoglycemia, in which low blood sugar because of losing too much fluids in the system, causing the sugar levels to drop. And lastly, hypokalemia, muscle cramping. What are the diagnostic methods? Some of the diagnoses are clinical diagnosis, stool dipstick, and stool culture for vibrio cholerae. Here are just a few examples of how to distinguish if the person is affected of vibrio cholerae. And here are some treatments. It is very important to rehydrate the patient. The person who is infected has lost a great amount of fluid in the system. How to rehydrate is oral rehydration solution. Let the person drink water to hydrate. The other way, if the person cannot hydrate, using oral rehydration is inserting them an IV fluids, in which the person is directly getting nutrients from the fluids inserted to them. Second way of treatment is a type of antibiotic called tetracycline. Tetracycline is mostly used to treat gastric infection, intestinal infection, respiratory tract, urinary tract, and body system. The other antibiotic is called ciprofloxacin. It is used to treat gram-negative bacteria and only used if the person developed pneumonia.